Hello, everyone. Again, this is a lecture by Blaine Parrish that was developed for this course last year. If you're having any trouble with any YouTube lectures or materials or links on the course, just send me an email. Okay. Again, Blaine is an assistant professor in the Department of Health Policy, also in the Department of Prevention and Community Health, and this is really a good, extensive lecture for you to listen to. I'm sorry that you weren't, some of you, well, sorry, all of you weren't able to access it last week. Again, just let me know when there's some problem, and then I can correct the problems promptly. Thank you.
Good morning and welcome to Designing a Community Engaged Research Project. My name is Blaine Parrish. I'm an assistant professor in the Department of Prevention and Community Health and also in the Department of Health Policy and a grantee for the pilot projects for the CTSI grant with GW and children. So that's probably why I've been asked to present this session this week. I am not going to go over a lot of the readings or the other material that is already posted because I believe that you can pick and choose from that what you're interested in. And I'm going to focus mostly on the discussion question and also the project that I designed for the pilot and what we're hoping to use as the basis for an R01 project and some additional community engagement projects. So I thought this was an interesting quote. It is true that someone has to be in charge of a project or interested in or be the force behind some new intervention or some way to move public health and medical care forward. But the community finds many times when we come from the academic world, we have only as our focus the publications, the gathering of knowledge and information to further our own processes or to get grant funding or to cover our time, etc. And many times I think the community has seen that, and I'm sure that you've discussed this in your other sessions in the discussion questions. But really, there isn't any one person or one organization that can fully own a topic or an issue. And that includes the community. Many times we have advocacy groups and others who believe that their voice is the one that should be heard the most, and many times it is heard the loudest. But we know as public health professionals and practitioners and also clinicians that many times a community on their own is unable to identify the root causes of some of their issues or to put together an effective campaign, intervention, etc. And so while they may have and ultimately be the focus of whatever endeavors we have, our voice as academicians, our voice as practitioners and clinicians is equally as important. So I'm not going to go over much of the information in this slide because you can certainly read it for yourself. But there is definitely a long list of benefits to engaging the community. Now, I'm assuming that everyone who's listening to this presentation also already understands community engagement. Each of us is a member of a community. We want to have our voices heard, whether it is talking to our own physician or going to a PTA meeting or a community meeting about school boundaries or going to a meeting about changes in healthcare coverage, whatever it might be, from the smallest issue that affects us individually to the larger issues that affect people of like mind. And so I don't think that I need to spend much time discussing what it's like to be a member of the community and to have your voice heard. Certainly, any of us who have been on the end of a telephone where we can't get a live person become enraged after a while at thinking that they don't value us because they're not listening to us individually and they're just putting us through the motions. And I think that that's part of why this course is being offered. And many times the community feels just like that. that when they call us as a university, all they get is, no, you have to do this, no, go this way. And they're not asked what would be the best way for us to meet their needs. And so you see before you a list of benefits of engaging the community. Probably the most important is the involvement in analysis and interpretation. Many times we take all of the data back to our office and analyze it and then come out with the findings. And really what we should be doing is taking the data and the community member and many others back to our office and analyzing it together and saying, does this sound right to you? Does this look right? Could it mean something other than what it seems to mean to me? And while we may think as researchers that we have the tools through our wonderful methodology and all of our tools that have been validated and proven to be reliable, the truth is the community may look at that and say, we kind of already knew that, but what we really think is interesting is this little thing that you see over here. What's that all about? What is that? And so it gives us an opportunity to see even if we're focused on the right issue for the community. And we may have, again, our own issues, but the community may point us in a direction if we involve them in the analysis and the interpretation that we might not have found. Now, describing the barriers wasn't included on the main page for the discussion for this week, but I thought that it was something that that certainly needed to be covered, because there are the community barriers to research, and then there are the academic barriers to research. And again, I'm not going to read through this entire list. You can certainly do that while I'm talking, but the one that I wanted to really focus on is time. We as researchers have as much time as we need within the confines, obviously, of the grant, but we have as much time as is purchased. So we can go out to the community anytime. We're the one driving the research most of the time, meaning that we have been funded and are usually subfunding the community. And so we think of time relative to our own goals and objectives, and finally at the end sharing that information with others. Organizations, not so much. Most of you have already worked probably in the field or worked anywhere. And you know that at any time, let's say retail, you're sitting with 3 or 4 people and you're helping, and another person comes in and all of a sudden they're demanding your time. They're in a hurry, they need to have a dress or a suit for that evening, and they really could care less about the other people that have been waiting in line, and they're demanding your time. And you try to negotiate with them, to kind of work with them while you're working with others. It's the same with the work that we do. They, meaning the community members, are engaged in providing medical care. They are scheduling patients, clients. They are working on their interventions. They have 5 or 6 other grants. And yet when researchers come in, we tend to monopolize their time and remind them that we are paying them some money to engage in this research activity. And it usually, especially with community-based organizations, falls on one person. And I know that many of you are probably shaking your head yes, because many of you may be that person, where you really are the one carrying the load of projects and juggling that kind of interaction with a larger community while frontline staff are trying to provide services. So I just want it to be clear that if you can't overcome the time barrier, you will end up with very poor data, a very disinterested partner, and someone who won't speak kindly of you in the community. Now, there are academic barriers as well, and you'll see that the top one is also time. But for us, it's the time it takes to really be accepted in the community. Unless you already have some entree into the community, it's a tough road. The community is even as excited as they might be about the research that you want to conduct, they are very wary of the amount of time they're going to spend, and honestly and rightfully so, what they're going to get out of it. Feeling much like guinea pigs or some kind of lab rat, rather than feeling like a full community partner. And so we have to be very conscious that we're going to have to put a lot of time into the community. And that what we might find, and you'll see this at the end of the slide, what we might find is not of interest to a lot of individuals. And so we have to just make sure that we have a really good focus to overcome these barriers of spending the amount of time that we need to, and just letting the research lead us where it's going to lead us, and then appropriately picking the places where we think, not us, not our need to publish and to have that show on our resume or our CV for promotion or tenure or whatever that might be as a researcher, or even additional funding, but more that we actually care to disseminate the information to those organizations and like-minded individuals that can do the most to affect change in the offering. So the last of the three topics, I believe, that were listed as discussions on the page before I get into the actual design of the project that I'm working on now, is to describe the different designs for community engaged research. Now, I'm assuming, again, that most of you are familiar with these research designs. There are a multitude of designs within each one of these categories, ways to affect the design, and the methods, which I actually am covering on the next slide. But random controlled trials, randomized controlled trials, most of you are familiar with. Quasi-experimental, I put queasy next to that because there are many purists who give them a queasy feeling whenever you're not sticking to the real random controlled trials, and where you're not doing it randomly, although you are in ways controlling the trial. And so I put that word there just as a way for you to remember it. One of the more common research design is the pre-post test design, where you give a pre-test to both a treated and what you're going to have is your treated and non-treated groups, and then do the intervention with your treated group, and then do a post-test with the two. Certainly, many of you are taking research design courses, and I will leave it to that course and your own reading with what was already posted to get the pros and cons of each one of these different designs. But each one has its own purpose, and certainly you're going to have to start by deciding which design best fits in with you and your community partners on on getting the information that you would like to inform over the topics. So next you have non-experimental, which is no manipulation in the group. And finally, you have observational. And I put next to that defining theory, because you really need a defining theory, although you are just observing and you're not interacting in any way, and you're just taking what you see, what they're experiencing. You still have to have that grounded in some theory or some idea about why you're there and why you're looking at it and what kind of outcomes you're expecting. Otherwise, you're just sitting there looking without any focus. And so maybe it's some kind of theory around human behavior, and that's what you're wanting to observe and what you're wanting to write your story about. So I just put that there as a reminder that you really do have to have some kind of ground framework, conceptual framework, in order for you to conduct good observational theory. And then I've put some the links for the information that I got for each one of these slides so that you could have more. And so here are just a few methods, just so I could highlight again for some of us who may not have as much experience in design and methods, what some of the methods would be, especially those that the community are most familiar with. Obviously, a method that would implement some kind of intervention and that would allow us to have an actual, usually it's a best practices or some kind of evidence-based intervention that we are testing in a community. Data analysis as a method, which is basically when I had my time working at HSCI for the government, it was a bean counting kind of method, where it was more about just looking at the data that came in, and seeing how many of this we did and how many of that we did and how many of these that we said that we would do. I don't find that method particularly rigorous or interesting, but the community loves it, because if I give you $100,000 and tell you that you have to provide 400 medical transports, you can come back to me and say the method for us to implement and to review and evaluate this program is to provide these 400 units. And so I did, but that doesn't tell much to the researcher or even to the community about how effective those were. How many times did you have to actually try to get someone to a medical visit before they actually went? Is it cost effective? How much do you spend on it? Are there other ways that you could be doing this? So that's a method that needs a lot of attention. And then I went into just some that are the most used in the community, and that would be written surveys, live interviews, focus groups, as methods for gathering data to analyze. And certainly community groups are used to that, and many times they're left out of the process of defining what is going to be in the survey or the interviews. We're very good usually about, when we run the pilots, getting feedback from the organization, but again, and you're going to see from the project I proposed, many times I think the way that we define community and community engagement is very limiting. And so live interviews and written surveys, if they have a review, a return rate of 10%, what are we missing? And if we're actually selecting people, or other people, as you see at the end where it says focus group, self-selected, advocate selected, organization selected, you can get very different answers. And so you really have to take a long look at your method within your design to see if you are reaching the stakeholders that you need in the community in order to get the kind of response. And you have to include the community and know them, and this is the time part, you have to know them well enough to gauge whether or not they're giving you access to individuals and to data that are going to benefit you as a researcher, but also are honest as a community member, giving you an honest look at themselves and they're serving in their community. So the last part of, I think, your responsibilities are to design a community engaged research project. And this is the project RFA that I responded to for the CTSI, and that was for pilot study programs. It's a year. It was $50,000. It didn't include money for my time, that covered the time of the researchers. And there are Monique Turner from Prevention and Community Health, Jesse Pines from the Department of Health Policy and the Quality for the Quality Center, and Kalpana Ramia, who was with GW and now works for another organization but still is on this project, are the four researchers who, and myself, who proposed a project to the CTSI specifically to look at sentiment analysis as a community engagement tool. Now, sentiment analysis is a new field for public health and for the medical field. It's not new for business, and that's kind of how this all came about, and the reason that I'm covering this project. When you get ready to design your project, many of us sit in our office, I've done this many times myself, and thought, okay, what am I interested in and what would I like to work on? Or let me go on grants.gov and see what's available, what grant opportunities are available. And that's fine, that's one way to do it. But another way, and that's how this project came about, was just reading a news article out of Johns Hopkins where a group of individual researchers had been looking at the changes in calling swine flu by its real name. And the whole purpose of the project was to see if the CDC put out information on H1N1 and started telling people that they should call it something else, that they shouldn't call it swine flu. Would that change how the community responded and talked about the pandemic. And sure enough, when they looked at the thousands and thousands of tweets and messages on message boards, etc., the more they put out the intervention of don't call it swine flu, don't call it swine flu, the more, and with each one of those iterations, the more people started calling it by its name rather than swine flu. So I just thought that was interesting, and with the advent of Facebook over the last few years, and my own children using social media and seeing how much information they share, which I believed was way too much information. I really got interested in how communities are talking about public health interventions, how they're talking about public health issues, and how clinicians and public health practitioners are translating their research into the community and then hearing what the community is saying, aside from what I just had mentioned earlier about the very limited focus groups and written surveys. Because again, those are controlled environments where people are expecting many times an incentive. They give information that they think that we want to hear, and even if they say they're being honest, we don't know if they're being overly honest or wanting us to think that the problem or the issues are much graver than they might be in their individual lives. And then we have to, take that times 100, and maybe 75 of those people out of 100 don't feel that desperate or that they're not getting what they need. And so I believe that social media can actually provide us a better picture of the community sentiment, and that we can use that in many different ways. And so if you've been reading on this slide, you'll see that that's exactly what I said. I believe it's a systematic approach that will provide the sentiment of a community to engage them in ways that we've not been able to do before. And so that's what we propose. So I believed that we could look at asthma, or not asthma, I'm sorry. I'm also working on an asthma project on that we could actually look at vaccinations and autism. And again, this was the same time that I was writing this, and this is, a part of developing your project. There was an article that came out that the Supreme Court was getting ready to rule on federal law shielding drug companies over vaccinations, and also the final retraction of the Andrew Wakefield article that alleged a link between vaccinations and the development of autism. And I thought, well, this is a perfect opportunity to see if sentiment analysis works. I will, working with a company called Binary Fountain, which actually does sentiment analysis for business, meaning all of those websites you go to where you see all of those reviews. This company looks at those and tells your hotel, Holiday Inn, yes, they like this. They're mad they have to pay every night for their Wi-Fi. They are trying to do the same thing in public health, and so it was a great partnership with a private community organization or private business, and then also to link in the health department in DC and their push to vaccinate all of the children in the district, and then also Autism Speaks, which is a national organization. So we got the best of all three worlds, someone from the private sector, someone that's doing public health and clinical services through a health department in a state or the district, and then a national organization that really garners a lot of sentiment around the topic of autism on their websites, and many of the websites that are linked as well to their website as well. And so it was really the whole purpose of this study was to bring all of these individuals together around these two events and say, what happened before these events as far as chatter on social networks and social media, and what happened when it was announced? And can we gauge what people thought about that, and how could the community use that information to improve either its message, its targeted intervention, to get out in front of whatever the questions might be, and that's what you see here. So once I just kind of decided on, what it is I wanted to know and who I kind of wanted to be involved, then I worked on what the specific aims were going to be. And even if it isn't required in your grant proposal to write what those aims are, really think these through. What are you aiming to do? Mine first one was really to partner with Autism Speaks and the health department, to find out what it is we could do with the information to either increase engagement, increase the amount of knowledge. But I'm going to criticize my own study here for just a moment. I did all of this on my own. I mean, these ideas all came to me linked together. I took a little piece from here, and then this fell in whenever I saw the news article about the the two events that were coming up, the retraction and also the Supreme Court case. And so I put all of that together, and then I started reaching out to the community members already with this idea of what I wanted to do pretty solidified. And so let me tell you, on AIM 1, one of the things I found when I met with Steve over at Autism Speaks, and I said, here's what I want to do, and I want to find out what people are thinking about this. And so if you can tell me where I should be looking for the information apart from your website, and where you think, and he was like, well, wait a minute. We really are an advocate around care for people with autism, and so kind of getting involved in this political discussion about does immunizations cause autism. While we put the information out there, we're really not taking a stand. And so for a second I was sitting there looking at him thinking, you've got to be kidding. I mean, isn't this the whole reason Autism Speaks is out there? I mean, from what I've read on your website. And it really isn't. Autism Speaks really does provide the best information, and certainly they're following the science, but they weren't willing to right off the bat say that the sentiment of the community was that this whole issue was nonsense, and other than Jenny McCarthy, there really weren't any loud drum beats from the other side of someone nationally wanting to take this on. And I had to respect that, and I had to respect that my premise and my notion that they were going to be interested because they wanted to dispel finally and tramp out this whole notion that the two were related, wasn't their focus. And that if I wanted to make this technology available to them, I had to hear what it was that they would like to gauge in community sentiment. And that seems just real obvious when I say it, and you're probably all shaking your head and say, well, yeah, isn't that the whole point of community engagement? But again, that was one of my own criticisms of my own study in designing it, is that I just assumed from what I saw on their website and what I was hearing in the community without a focus that Autism Speaks would want to be engaged in that specific part. And really what they want to know is what people are saying, more than they want to get involved in controlling the conversation. And that was interesting. And not the same as the Department of Health. The Department of Health, obviously, to me, and which became the case, is that they want to increase the number of children who get their vaccinations and get them on time, and they see this as a real barrier, not because they believe that many community members advocate that there is a connection, but that they have to overcome that people have heard that, and that takes more time in the visits and more energy and money to dispel what they believe is debunked science now, and bad science, and that takes a lot of their focus off of being able to reach more people because they spend so much time with the people that they reach. And so that aim of partnering and was an important one. The next three aims I'm not going to spend as much time on, but you'll have to do this as well as you're putting together your project. And that is getting down to the nitty gritty. So we have to test this lexicon of words. And again, everything that you see here as an aim, they're grounded in some, and I was talking about this with design and methods. It's all grounded in other research, other science, other findings. And I can't stress enough that it's okay for me to go out on a limb, and I certainly appreciate the CTSI folks for letting me do that, because this is not a traditional type of pilot study. They let me go out on a limb, I believe, on something as untested as sentiment analysis in public health and translational research, only because most, if not all, of the rest of my study is grounded in work that has already been done. So this lexicon of words coming up with, Dow Jones did that with the University of Notre Dame and Columbia a long, long time ago. And they use, it's called market sentiment. Many of you may have heard about that, the bulls and the bears. And so that's how they kind of watch what's going on in the markets, is that they have these words that they put positive and negative definitions with, and then they look at that and give it a certain weight in their algorithm to decide whether or not the market is feeling bullish or bearish. And so that same kind of process is what we're working on to come up with and test a lexicon of words of our own. The third aim is this systematic approach to harvest these conversations. Again, very grounded in research that's already taken place, as I said, in business, with your airlines and your hotels. And it's just basically people coming online and saying, I liked this, I didn't like it, it was good, it was bad, I had to pay too much, it was too expensive. All of those are harvested based on an algorithm that is written by this company, and so we have to do the same thing. What is a systematic approach in public health to look at and rank the sites? So, for example, if I'm getting all of my information from Twitter, so lots of people use Twitter, and I'm getting information from a little website that maybe has 500 hits a day. Obviously, if I'm weighting those outlets, I can't weight what comes from the 500 hits a day website from what I get from Twitter. So I obviously have to develop some systematic approach to say, okay, here's a conservative website, here is a liberal website, here is one that has 50,000 subscribers, here's one that has 1,000 subscribers, here's a person who writes every day across 50 different websites providing information, and here's a person that provides feedback every day, 100 messages on this one website. Our task is to figure out how we gather that information and how we weight it so that the community sentiment is actually not that it's not owned by one person or influenced by just one person. Because then we'd be right back to where we started with having a focus group, which we don't want to do. And so you're going to have to do the same in your own project and figure out, is the data that you are gathering, how are you making sure that everyone's voice is heard and heard equally? Or if there isn't an equal conversation, is there a reason why? Is it drowned out? Someone big has, monopolized the conversation. And so that's part of what we're working on. And then you see that in the fourth aim, developing this algorithm and this dashboard where any community member can pull up this dashboard and say, you know what, I wonder what people who are age 45 to 60 are thinking. And again, that part of our systematic approach is having to find out if there are websites and other places where it actually says who they are. So let's say we crawl all of the open pages on Facebook. We can tell their ages, scary as that may be. The same when people post their response and it says it's a 45-year-old female from Abilene, Texas. So we can do that as well. And so that's important to the community members' organizations, but we're finding too that it can be very disconcerting to the individual community members, even though it's not their own information personally or identifiably. on that site, they're starting to say, wow, so anything that we say out there in the community, you can kind of get. And I'm finding that those are mostly older users. The younger ones certainly understand that what they're saying is out there and that anybody can read it and at any time anybody can grab it. So that's part of what we're doing when we're developing that. I'm not going to read the background and significance. Certainly, you can read about sentiment analysis. But I will say again that while you're writing your proposal, you need to think about the background and the significance. Certainly, the background is just going to be looking into the literature and, where were we, what happened, and in our case, it was social media, what happened to kind of change the conversation, and what do you want to do with that change? And so social media was the change. Sentiment analysis is what we want to look at. And so that's how you're going to have to build. But you have to have that. If you want someone to fund your project, they have to say to themselves as they're reading your background, oh, I see what you're talking about. And how is this going to help the community? Oh, I see how what we're doing now has its barriers and challenges. And what you're proposing is really going to overcome those, but take us a step further. And so just make sure that when you're reading it again or someone's reading it, that they're thinking, wow, this is really interesting. This would be quite a change. And if this were something that you could make happen, and that's in part, if that's something that you could make happen, I think you really would see some good results. Many times we focus a lot on the little graphs and charts that we provide later on when we're talking about our own methods. But I'm a firm believer, and from my time at HSCI reviewing grant proposals for minority organizations that wanted to add clinical HIV services and rural organizations that wanted to do the same thing, going from just community-based organizations that did prevention into community-based organizations that did prevention and clinical services. I think I know that the most successful applications were those that seemed to already get it when they were talking about the background. They fully understood where they had been. And in the cases when I was at HRSA, it was, we understand that buddy programs, volunteer programs and services, food pantry are definitely needed as ancillary services for people with HIV, but with the advent of HEART, and now that being the standard of care, we really have to move past these other services and put our money into medical case management and the clinical services for people with HIV. When they understood that and said, that's why we want to open this clinic, because what we're doing isn't enough and things have moved away from the standard of care that we had before, I knew that they got it. The ones who never talked about that, never mentioned it, and basically said, we want everything under one roof, we have all these other services, now we want clinical, they didn't seem to understand that they needed clinical, that it was the future of and standard of care and best practice care for HIV. They were looking for money, and maybe they had these other thoughts in the back of their head, but if I don't see it in a proposal, I can't evaluate it, and I just have to go with the ones that really did seem to get it. So make sure in your background that you really tell the story of what you think and why it's changed and why this is important to you. Again, I just talked about the previous technology, so they knew that this had been done before. And then the significance part, obviously you want to leave them with an understanding that there is something significant about the work that you're doing that will benefit the community. And you'll see in the last part, on the last bullet, that I made the case that this wasn't about autism and this is not about immunizations. And in fact, when Sebelius's recent overturning of the Health and Human Services finding that they should lift the requirement that girls under the age of 17 have a prescription for Plan B, we decided that we would add that to the pilot, that we would look at sentiment and discussions about Plan B before Sebelius's announcement and after. And we're finding exactly what we would think, which is people were outraged. But what we're looking at is how outraged. So how outraged was, quote unquote, the left, and how outraged was the right. And can you gauge what as a public health community we can do with that information. And so my point is the significance of this study was not and is not about the specific issue. It's about the technology and the recognition that social media is here to stay, and that we can actually tap into it and use it to better define our message, target our message, and to provide the community a way to have a quick response locally to what is happening, so that, for example, the Department of Health, um, if they have this technology, anytime they see a national story or a story that's district-wide about health and health issues, maybe myths, gossip, some case comes up and all of a sudden it's all over the news, they would be able to use this technology and this dashboard to look at what people are saying and quickly put out information that helps inform the community. Even if you want to be like an Autism Speaks and you don't want to define the conversation and you don't want to lead the conversation, at least you can put out information and say, we know this conversation is going on, so here's some helpful information, or here's some science, or here, are some resources, whatever that might be. Public health change moves so slowly in public health, and even in clinical care. It takes a long time for us to change the behaviors in a community and to get positive health outcomes. We should not add to that our inability to quickly respond to community sentiment, and that is the significance, and that's our own proposal. And so I'll let you read this, and you can just kind of compare your own telling of your story to what I'm saying is important for researchers and for practitioners, and also for stakeholders in the community. And so I show this slide again to show that while I am talking about the significance of sentiment analysis, I'm also showing that there are the significance of us making change is important as well, especially in getting vaccinations for children. Again, here is the significance of the intervention, of the innovation, and I believe that it's something that you need to think of in your own proposal. And again, a group just wrote a proposal for CMS, Medicare, Medicaid, for their innovation grant. And so you were supposed to come up with this wonderfully innovative response to a community health issue and show how your innovation will save money, retrain the workforce, and improve health outcomes, and employ more people. And so, again, everyone's looking for some kind of innovation and something that's different. So I sat through a lot of meetings of individuals that were putting together their proposals, and it was like they were dusting off grant applications from 5 years ago with these wonderful interventions and ideas that they had that were very outdated, but also were not innovative, and it was nothing new, and there was no significance that I could see outside of, obviously, if these interventions, etc., work, you would be changing health, improving health outcomes. But that's any grant application. And your grant application is sitting next to everyone else's, and if it looks the same and it does the same, then you're already at a disadvantage, depending on if you're the smallest organization, or you haven't been around as long, or you're not as connected as the other organizations. I can tell you again from my time at HRSA, it was the innovative approaches that were built on some significant event or something in the background of the issue that made a compelling case for me to either give that organization a chance, or at least to rank them up with everyone else and let us fight it kind of out at the end. And so, again, you have to find that innovative, that special spark in your proposal that gets the reviewer to pay attention. And a lot of times, most of the time, the reviewers are people from the community, and what is going to engage them as grant reviewers is your ability to make the link between, I know this is a problem, here's what I see is happening now, Here's what I think might be helpful. Here's what the community says about that idea. Here's how they can be engaged. Here's how I would like to support them rather than the other way around. And here is how, this innovative approach, this is what's going to get the job done. Because again, in public health, clinical services, most of these interventions, most of these ideas have been tried in one form or another, and they're really looking for something that goes around all of the barriers and challenges. And so the innovation part is important. I'm not going to read the preliminary studies, only to let you know again, it's extremely important that you show that you understand what is in the literature. And I can't tell you enough how many of the applications that come in that have nothing about the literature. And, for the community side, if you think that, writing this grant application or just kind of supporting them in writing this application, and you're sending it off to HRSA, and that you're assuming that everyone there is, an idiot. You always hear bad things about project officers in the federal government or whatever. Having worked for the federal government, I can tell you that they are not all idiots, that there are thoughtful deliberations about who to fund. And again, those that were the most compelling were the ones that understood that they were not the first one to do this. If you write an application that says you're going to engage the community in this wonderful new idea of disseminating condoms to stop the spread of HIV, I'm going to look at that application and say, have you not read the literature that that's fine, but that is a first step approach, and everybody's already doing that, and that the literature is very clear that in order for that kind of approach to work, it has to be coupled with other types of intervention, face-to-face discussions, health fair booths where you actually provide opportunities for education as opposed to just passing out condoms. And so please make sure, even if the grant application does not call for it, that you pepper it with references to literature that show that what you're saying has happened in the past has happened, that there is support for the approach that you're using, and that there is something in the literature for you to build on. In the instance of this application, the whole lexicon of words and algorithms and everything that's used in the business world. It's very, very important, and it certainly makes your stand out. And again, I have more information here on some of the research about sentiment. And I'm going to show you these slides. You can certainly read them on your own later when you can turn my voice off and just go through them again. And there's the information about swine. Basically, we're all used to working with the same thing, and that is charts and graphs and forms that the federal government gives us, medical charts, now electronic charts to fill in. So there's plenty of time for all of that. Keep your application very clean, very neat, easy to understand, easy to flip through, and a story that starts at the beginning and goes all the way through. I can usually tell an application that's written by 7 or 8 different people that's thrown together in the end without anyone going through and kind of massaging it, because it doesn't seem to flow. And so, spell out your approach. And in this instance, I was just working specifically with what we've something that the NIH has discussed in the past about how we get evidence out through all these different agencies. And I believe that in order to do that, having the right information to get out there is the most important. And so I just broke it into different phases that I thought were pretty easy to understand. And again, I'm not going to read these because they actually talk about the specific activities. And that's something else. When you're writing your proposal and you're developing your proposal, the actual activities, that's where you should spend the majority of time with your community partner. Because you know what? Outside of the research activities that you're going to be doing as a researcher, most of the activities are going to fall to the community partners. So gathering data, meeting with clients, writing down notes of changes in their patient flow, or the amount of time it takes to train the community health workers to provide the interventions in the community, writing out policies and procedures that would govern the use of cell phones in the community, or giving the community health workers phone numbers out to people they may meet at bars for HIV outreach or whatever. You have to be very careful. All of it needs to be vetted by the community, but the activities part really needs the most time, and that's really really important for part of what you write into your phases. My phase two, and again, my project is a little bit different, and I did want to say something about this. It's different because it redefines in a way what community, in quotation marks, what community is. Because for me, the community isn't just geographically located individuals, although it is that. My community is the individuals from that area that connect themselves through social media. And so it's a little bit harder to kind of pilot what you're doing with the individual people, but that's my whole point in this proposal and in what we're doing, is that I'm trying to get people beyond that, beyond thinking that they have to go out and touch the people, because the people are actually trying to touch us. Nobody puts information out on social media and expects no one to read it. I mean, what's the point in doing it? You would just keep a private diary. And so they want people to see this information. And so this is actually, I believe, a better way to engage the community, because they're unsolicited by us. They're giving us the information that we want. We just have to find a way to harvest it. So once again, what I have to do is constantly check myself with the community and say, are these the people that we're trying to reach? Because they're reaching out to us. And if we're going to push aside what they say and not give it any weight, do we have a good reason for doing that? Because unlike the 10 people that we get in a focus group that sit there that have been invited and we're giving them a $20 target card, and that they're probably going to say what we want them to say, these are individuals who are screaming to be heard. And so that kind of engagement and that kind of focus is important when you're writing these the different phases of what your approach is going to be. Is to make sure that you're defining all of the different possibilities and showing how that's important. So once we do all of the work that we do in the lexicon of words and getting together with our partners to make sure that they're fully engaged, then we have Binary Fountain actually crawling all of the media sites, gathering the information so that we can tag whether they're positive, neutral, or negative based on our lexicon of words. And the more you tag the words, many of you may know this, then the program starts to do it automatically, so you just have to go back in and check. And so here's where in my project, and in yours as well, you have to check your bias. So this is where having that algorithm and deciding if I'm going to do Fox News, CNN, ABC, the Washington Times, the Washington Post, the New York Times, the New York Post, I have to make sure that when we write the algorithm, I'm not pulling everything from the more liberal media, because there is, I mean, you can go to Fox News and you can go to CNN and you can see the stories that they're covering and see what they're saying about it and what the people who are reading it down at the bottom of the page are saying about it, and pretty easily tell what kind of readership they have. And based on their readership, I go to sites, I mean, I look at all of them, but most people go to sites where the coverage kind of follows in their own idea of their views, their kind of life views. So, if you're a very liberal person, you're likely to, get an aneurysm if you're sitting there reading Fox News every morning, because they're very focused on more conservative issues and follow the news in that way. And so in order for you to write your proposal and to be sure that you're not already saying, well, here's what we're going to find and here's what we need to do, you have to kind of check your bias. And so the way that we're doing it is making sure that we kind of look at other organizations that have ranked, both liberal and neutral organizations that have ranked both liberal and neutral and conservative outlets, and make sure that, much like political pollsters, those who work for the campaigns, do the same thing, putting a mix of Republicans and Democrats and independents in. We have to find that balance to make sure that what we're capturing as the message in the community is a cross section of that community, and that we weight those responses like the community would look. So, for example, if we have a very, let's say, educated community, very connected as far as those are the individuals that are on the social media a lot, have a lot of time perhaps to share their ideas and to feel that they are being heard online, as opposed to those who may not have a computer at home or maybe less interested to share those kind of ideas in social media and be using social media for a totally different purpose. We have to make sure that when we are listening to the story that's being told on social media, that we actually are hearing everyone's voice. And so that's a part of understanding your own bias, understanding the bias of where the media that you're collecting data from, and you're going to have the same issue. And I'll say again that if it's in collecting your data in focus groups, surveys, etc., you have a difficult bias to overcome because you have to gauge whether or not the information that you're getting is real and true and honest. And that's why most researchers like to stay away from anything that's squishy. So like the hard science versus the soft science. They'd rather, put something in a laboratory, watch what happens from A to B and then from B to C, and then be able to write about it. And that's fine. And there are many of the designs that I showed you earlier. You can actually do that. And there are protocols for that. But I honestly believe that, what we're talking about in this class is translational research. So how do you take what you found out in the laboratory and actually get providers, clinical providers, public health practitioners, etc., how do you get them to implement that in the community with the community's support? Because you know what? It doesn't matter how good your science is. It doesn't matter how good your research is. It doesn't matter how good your findings are. If you take this pill or this physical exercise or this medical treatment or this intervention or this prevention message or this education message to the community and they look at you and say, I'm not taking that. It doesn't matter how long you talk to them about how good it is for them. All they have to do is say, I'm not doing that. And all of your research and all of your work and all of your wonderful findings don't matter because they're not going to do it. We found that in the beginning when we had AZT treatment for HIV. As much as people wanted to live, the side effects were so horrendous, many people would not take it. They just wouldn't take it. It was not worth the side effects for them, even though we tried to convince them that sooner or later we kind of work through those and we could work on the other effects. That wasn't good enough. And so you have to remember when you're writing your proposal, just as I have to remember every time I write a new proposal. Unless I've engaged the community and unless I'm able to find an approach that mitigates whatever their concerns might be, it's a worthless endeavor because it's not going to improve health outcomes to do it. And finally, phase 4, running and aggregating the data around these two events. Is kind of the last part of what we're doing so that we can look at what we find in the community and say with our community partners, the Department of Health, saying, well, it's not that big a problem in DC because if you look at the sentiment, most people are saying that they get the vaccinations anyway, and they're totally different message. There was lots more discussion once these were in the newspaper and once these were on the news, but the conversation in the community wasn't about the link between autism and vaccinations. It was about something else. And that something else would be of value to the community partners to be able to say, well, then we don't need to be putting out messages about that. What we need to be doing is listening to them say this other thing. And so that's hopefully what we'll find. And I'll say again to you, the best outcome you can have from your proposal, your study, is to find the other things that people are talking about that you may not have been aware of, or the other things that people are doing or that you can do. And certainly if you're listening to the community, and you're going to find that out. So here's just an example of a sentiment analysis dashboard, and you can see, I can. Right now we're working with local communities, but if we're crawling and we're able to regionalize and tag in different places, I would be able to go to HRSA, and if you just look at that map of the United States, I'd be able to go to HRSA and say, see those places in green? You have real problems there. The community sentiment and what people are sharing there is extremely negative. Or I could say, if you look at the green, it's extremely positive. If you look at the red, that's extremely negative. And so really you don't have to target your message around whatever the subject may be everywhere. Most people seem to be getting it, but you have a real problem in one state and possibly another problem in the yellow state. And so you should be spending your time and resources and money there rather than trying to blanket the whole United States. And then they could click on one of those states and be able to say, oh, it looks pretty good. Or, yeah, it's green, but look at these other things that they're saying about, this topic. That's what we're hoping to be able to provide. And that's something we wrote into the CMS grant as well, actually using a dashboard, but instead of this kind of national, it's looking at the sentiment of the individuals who actually get their services at the community health centers, and in this case it's community health centers in Lower Connecticut, based on what they say in exit interviews using tablets. So it's kind of like the surveying, but they're anonymous tablet surveys that they're able to do. And then also anything in social media that are covered by that area where people are talking about their health care and talking about the community health centers, including on the community health center site. And then using that information, but also feeding in utilization. So who's using the services? What services are they using? How often are they using those services? This dashboard idea is really a way to put the data in a system where it can actually be pulled up and of use. So it's not like a UDS system or some other system where you can just pull out the raw numbers and it takes a lot of manipulation. This dashboard actually provides them with this opportunity. So what is it in your proposal? What are you thinking about in your proposal that provides something like this, where anyone reading it would be like, wow? Because I can tell you, when we put this together and had it reviewed internally, people were looking at this saying, wow, so it's really going to do that? So they'd be able to tell, like over here with this pie chart, X, Y, and Z, and they could look over here, on the ratings and what would they be able to find about patient sentiment and patient satisfaction. And so this was our kind of, aha, look at this. This is innovative and it's something you don't have, but something you should have. And so what standard are you going to write in your proposal that engages them? What are you going to design and weave through your proposal that is at the end, just like this, when you're looking at this, you're going to say, wow, I'd like to see that. I'd really like to see how that's going to work. That's important. And, and so obviously up to this point is important to get you to that final kind of aha. And then you can see we put in our future direction, actually finding an opportunity at NIH for an R01 on dissemination and implementation research in health. We honestly believe that once this pilot is completed, we could be extremely successful in an application for an R01 because we think this could be the new standard for community engagement through social media. We're not going to get rid of and shouldn't get rid of all of the other designs and all of the other methodology and methods and ways that you can get information from the community and partner with the community. But we honestly believe that this is a field, sentiment analysis, and technology that should become a standard for in public health and in clinical care. I honestly believe that we're going to get a much clearer picture, but there are a lot of barriers for us. Chief among those being able to actually gauge sentiment. There are many people who are very skeptical of that. And let me say that about your proposal too. If you are, and you should be, proposing something innovative, you should be very honest about what you see as barriers. We certainly were in our proposal, and it was funded anyway, the pilot, even though they did recognize that it was high risk, but also high payoff if it were to prove to be a reliable way to engage the community. And so I would challenge you to do